Good afternoon, everyone. This is Amanda Pierce Kelly with NAC. I just want to take a minute to thank everybody for joining us for the TeleForum today. We've got a lot of important information to go over with you. As we near the end of 2013, the Health Center policy and advocacy agenda remains very active with some unfinished business that will require continued advocacy in the weeks ahead and a great deal of effort to ensure we close out the year strong and kick off 2014 with a clear plan of action and easy advocacy steps that everybody on the line can take to support health centers going forward. During the call today, we're going to update everyone on what's happened since our last TeleForum in September. We'll talk through what's pending in the remainder of this year and discuss what to expect from Congress and the administration in early 2014. Once we've talked through the policy landscape, we'll turn our attention to advocacy. We'll review our fall efforts, lay out remaining actions needed in December, and talk through what we're planning for 2014. Remember that if you have questions at any time during the call, you can hit *3 to enter the queue and ask your question live. Again, it's *3 at any time to ask your questions live during the call. So let's get started. I'd like to turn the mic over to NAC Senior Vice President for Public Policy and Research, Dan Hawkins, to give us a big picture lay of the land back in D.C. Dan?
Thank you, Amanda, and good afternoon and welcome to everyone on this call. I'm filling in for Tom Van Coverden, as you heard, who's on the road today in some important business. We all hope here at NAC that you have enjoyed your Thanksgiving and Hanukkah holiday and are ready to enjoy the year-end holidays as well. Here in our nation's capital, Congress is focused on wrapping up business for the year, which we expect will be done. It would be the first time in years, sometime before Christmas Eve, hopefully toward the end of next week. Having completed only 61 new laws this year, the 113th Congress is about to go down as the least productive in history, even worse than what President Harry Truman derided as the do-nothing Congress of 1948. Now, Caitlin will get into details on all the upcoming deadlines and what they mean for health centers and our priorities. But right now on the Hill, the big focus is on the December 13th budget conference deadline, where they're supposed to reach some sort of agreement in order to avoid yet another sequester early next year. And also on the same week, a potential Medicare physician payment fix in the Senate Finance Committee. But the dominant storyline here and elsewhere, as you know, has been the technological woes of the healthcare.gov website and the cancellation of policies for millions of folks in the individual insurance market. Within the next week or so, and the early news was positive, we hope to have some sense of whether the website improvements they've made have truly succeeded. And as always, we'll be looking to you, who are the boots on the ground out there all across the country, to learn what the real-world impact is so that we can make sure that the administration and our friends on the Hill know what is working and what still needs fixing. In the meantime, I want to express a deep and sincere thank you to you for your perseverance, your dedication, and your professionalism in balancing the challenges that the system has presented to you with the obligation to your parents that I know you see to see this whole effort through and to ensure that everyone who is now eligible for affordable health care coverage has the opportunity to obtain it. We at NAC want to encourage you in the strongest way to stay focused on this core health center function of helping as many people as possible to enroll in coverage, now especially and throughout the new year. I also want to remind everyone that we have a very important survey in the field, which was sent to every health center CEO a couple of weeks ago, asking about your experience in dealing with the qualified health plans that are offering coverage in your state through the exchanges or marketplaces, and whether they're contracting with you, and if so, at what payment rates. Please make sure that you return this very important survey by next Friday, December 13th. We need this information to fight for you here in our nation's capital. So even as FY 2014 funding efforts continue in earnest both on the Hill and for many of you who are advocates with targeted members of Congress, NAC is already looking ahead to next year, to the President's budget, and to fixing our health center funding cliff. Caitlin and Amanda will get into more detail on this effort in a minute, but know that the year ahead, 2014, is sure to be one of the most intense policy and advocacy years we have ever known in the health center movement. And if there's anybody here who remembers the block grant battle of the early 80s or the PPS battles of the late 1990s, this one is sure to beat them all. That is why we are so grateful that you are joining us today on this call, so that all can be informed, prepared, and energized for the battles to come. With that, I'm going to turn it back to Amanda Pierce Kelly, our National Advocacy Director, who will bring in Caitlin McColgan, our Head of Federal Affairs.
Thanks, Dan. I know there's a lot to cover on the call, so we'll keep this quick. Caitlin, can you give us a review and speak to what we have remaining to finish out the year and maybe what we can expect in the year ahead?
Absolutely. Thanks, Amanda, and thanks, Dan, for that great tee-up. I think our last call for this group on this national advocacy call was in late September. When I look back and think about all that has occurred since then, it's been a lot. I think everybody remembers the government shutdown that occurred, really largely led by Senator Ted Cruz of Texas, but then ultimately many members of the House and Senate who decided to make a stand on the continuing resolution to keep the government running on a temporary basis over defunding the health care reform law, or Obamacare as it's often called. That standoff was 16 days long and actually at the end of the day did not lead to any changing of the funding of health care reform. However, it did set the table for a lot of the advocacy and policy work that we are currently engaged in. So thinking about the history does influence a little bit of the conversation of where we're going to go from here. I think everybody in this call will remember that the government did ultimately reopen after a little over 2 weeks with an agreement, and it was an agreement that contained several key components. The first component was an agreement to establish a budget conference committee between the House and Senate Budget Committee chairs that had a deadline of December 13th, so again, that key date next week, of reaching agreement on the overall top-line spending for discretionary spending for the coming calendar or the coming fiscal year and the following fiscal year. At the same time, the agreement also continued funding at the post-sequester, that's the post-across-the-board cut levels from last year, continue funding at those levels through January 15th, 2014. And finally, the agreement also contained a suspension of the debt ceiling through February 7th. Those were the key components that Democrats and Republicans, House and Senate, agreed to in order to reopen the government on that October 16th date. What that meant for us, for health centers, was that the threat of a total funding stoppage ended, and we were really right back to where we were before the government shutdown, which was doing our advocacy on fiscal year 14 appropriations. Many of you have been engaged in this dating back to last year's Policy and Issues Forum here in Washington, and the work has continued through the summer into the fall. For many of you with targeted appropriations members, you've done work in person here with us, you've done work back in your districts, and the work continues even today. The work continues for us as well here on Capitol Hill. The clock is ticking on the fiscal year 14 timeframe. As I mentioned, the continuing resolution for fiscal year 14 expires on January 15th. But even before that, we have this deadline next week of December 13th, at which point everybody is hoping that there will be some agreement between the House and Senate on a total top-line spending number of how much discretionary spending will be or discretionary funding will be available to the appropriations committees in the House and Senate for this funding year that we are actually already in, fiscal year 14. That agreement is key to allow the appropriators to do their work in deciding at what levels to fund individual programs. But given that once that agreement is reached, things will happen incredibly quickly. We have been unable to wait until that agreement is reached, and we've been doing lots of targeted activities on fiscal year 14 in order to lay the groundwork for our ask, which again was our ask that we outlined way back last March at the Policy and Issues Forum. As a reminder for everybody, that ask is for $3.8 billion. That's a combination of annual discretionary spending, which is what's being debated now, and our mandatory funding from the Affordable Care Act. If we were to achieve that level of $3.8 billion, that would allow for a significant increase for the health center program, allowing for significant amounts of new access points, and we're hopeful expanded medical capacity grants, service expansions, including dental, behavioral health, pharmacy, vision, things that existing health centers have been waiting a number of years for since really dating back to the Recovery Act. And so that is why this $3.8 billion fiscal year 14 request is so critical to give you all the resources you need to do those expansions and meet the needs that you're seeing in your communities every day. As everybody on this call is aware, the administration has actually already acted on some fiscal year 14 dollars. We saw a little over a month ago, 236 new access points were actually announced. That's with our fiscal year 14 funding. So even though that final funding level has yet to be decided, the administration made a decision, I think, affirming the importance of community health centers and our primary care capacity to moving forward with healthcare reform and with the improvement of the healthcare system generally. They decided they just couldn't wait until the new year. But that being said, there's still a significant amount of our funding that is at risk as the appropriators will be making their decisions in the month or two ahead. So again, success is going to be critical in order to ensuring that we see those new funding competitions for hopefully additional new access points, EMCs, and service expansions. So that appropriations work is going to continue. At the same time, as Dan mentioned, we have already been working for a number of months on fiscal year 2015, which is actually the advocacy effort that we'll be engaged in next year. The reason why the work has started now is twofold. One, we have a significant health center funding cliff that's looming ahead of our program. I think many on this call are aware that as of fiscal year 16, if this funding cliff is not resolved, the health center program faces a 70% reduction in grant funding. Obviously, it's really important that we start to lay the groundwork now to avert that funding cliff. But beyond that, we know that the administration, the Obama administration, is already preparing the president's budget, which will be released early in the new year. So NAC has been working, as that budget has been developed, to do advocacy geared towards the administration and urging them to include this health center funding cliff fix in the president's budget. Many of you have been engaged in this effort with us. The Green Cummings letter, which I know so many folks on this call were integrally involved in, actually closed out with 149 signatures. You'll all remember that that letter was aimed at the Obama administration urging the president, this was members of Congress sending a letter urging the president to include the health center funding fix in his budget. That was an enormously successful effort. Amanda can speak more to that, but it was an enormously successful effort thanks to all the work that so many folks on this call did. At the same time, we've also been engaged in petition activities that are also geared towards the administration as a part of our effort to lay this groundwork. Come the new year, we will be launching a campaign that will be almost unprecedented in our health center history, that will be aimed not just at the administration, but at the Congress, urging them to fix the health center funding cliff. We will have an enormous task ahead of us, but we know that if everybody on this call is focused, is engaged, and continues to participate, as all of you are doing today, that we will be successful. So stay tuned. A lot more to come on that front. But for now, our immediate focus is on securing the rest of that funding for fiscal year 14 to get resources into your hands immediately and allow you to expand your primary care capacity, but also continuing to lay the groundwork for next year when we'll be engaged in our health center funding cliff fix activities on Capitol Hill and back in your districts and around the country. With that, I'm going to turn it back over to Amanda Pierce-Kelly.
Thanks, Caitlin. Just a reminder for folks, if you have a question, you can hit *3 to enter the queue and ask your question live during the call. All right, now that we have the lay of the land and we know what to expect this month in early 2014, let's turn our attention to our advocacy efforts. I want to start by saying thank you. Thank you a million times to the thousands of health center advocates that stepped up this fall on our Health Centers Fix the Cliff petition drive and also on that Green Cummings Health Centers letter. With respect to the petition, we shattered our goal of collecting 25,000 signatures in the month of October. We actually collected more than 40,000 signatures and still counting. We're actually over 45,000 at this point. I just want to offer a huge, huge congratulations to everybody who signed the petition and helped to collect signatures. You should be so proud of the results, and I'm happy to report that the White House was also impressed with the results. We're currently working with administration staff to schedule a more formal recognition of the outstanding advocacy response by health center advocates, and we hope to have details available really soon on how that recognition will be put out publicly. But I just want to be clear. Folks should make no mistake that the White House is very aware of our petition numbers. They're paying very close attention to our policy and advocacy efforts that have occurred already and as they will in the future. That Green Cummings letter, I just want to pause for a moment. The fact that we were able to generate 149 co-signers on that letter in a relatively short time frame speaks just wonders about our health center advocates and the level of support that exists in Congress right now. And so, again, just congratulations and thank you everyone on the phone. I also want to point out that advocates should continue collecting petition signatures and be prepared for a new goal coming out after the first of the year. We'll push the petition out beyond just the administration, which was our focus this past fall, but we'll push it out to the Congress and keep the drumbeat going on the Fix the Cliff effort. More on the Cliff advocacy in a moment, but first I want to remind everyone of the unfinished business and advocacy action steps that can be taken this month. Again, for questions, it's *3. For anybody that wants to jump in the queue to ask a question live, it's *3. Now, as Caitlin mentioned, we are still working to ensure we receive our full funding request in fiscal year 2014. For anyone who has a member of Congress on the House or Senate Appropriations Committee, you should be prepared for calls to action coming as soon as this week, to be quite honest. And for everyone, every single health center advocate out there, you should be working with your health center leadership to set up in-person visits with your members of Congress at your health center. As always, it's going to be critically important to tell the health center story. Share with your members of Congress the ongoing need in the community. Tell them about the jobs that the health center is creating back home and about the excellent healthcare outcomes of your patients. We really need to be explaining to our policymakers what's at stake for your health center, for your patients, and for the community. What will happen without the resources you need to provide the care and services that you have been so well and so with such quality. So again, for folks that have appropriators in both the House and the Senate, look for calls to action coming as soon as the next few days. And we're going to be counting on you to make phone calls, to send emails, and to ask your friends, colleagues, and families to be doing the same. We'll make sure that you have the background information and the talking points so that you're prepared to have the conversations. But again, we really need to make sure we shore up support in our FY14 funding so that we're in good shape at the start of the year when we take up the Fix the Cliff initiative again and 2015 funding. So when we talk about telling the health center story, and this is a great segue into our plans for advocacy in 2014, as you heard from Dan and Caitlin, we'll need to manage multiple policy issues in the year ahead, several that will be moving, quite honestly, at the same time, and not the least of which will be continuing our work on the health center's funding cliff. So to help ensure that we rally the support next to Cliff, we're right now 3 different advocacy initiatives. First, as you heard already, we'll redouble our efforts on the petition with a new signature goal in 2014. The petition will address, again, both Congress and the President, and we hope this will provide an easy vehicle for health center patients in particular to engage in our advocacy efforts and to show their support for fixing the cliff. I will stop and pause for a second. We are always looking for new ideas and suggestions about how to engage our patient population. We rely on the petition as a very easy way for folks to get involved and to weigh in on this important issue. But I will ask everybody that's on the call today and encourage you guys, if you have ideas or suggestions or thoughts about what more we can be doing to engage our patient population in our advocacy efforts, don't be shy about getting in touch with the NAC staff. You can always email us at grassroots@nac.com. But again, the petition is really going to be our primary means for engaging the patient population in our advocacy efforts going forward. And with that new signature goal, we will send a very clear message to Congress and the President about the importance of fixing the cliff as soon as possible. Second, we're planning a local letter campaign directed at local officials, meaning city councilors, mayors, selectmen, etc. We'll be asking advocates to obtain Fix the Cliff letters of support from local officials that will be addressed to your members of Congress. These letters are going to send a very strong message to Congress about the importance of fixing the cliff, and it will also demonstrate a really important foundation of support from back home in the community. We'll supply advocates with the template letter language, talking points, and all of the other resources you all might need to gain those support letters. But look for more information coming in the new year when we actually go ahead and launch this campaign. But we're excited about being able to engage this new set of local officials and, to be honest, hopefully educating them about the important role that health centers play in the community back home and the role that they can take in advocating to make sure that the health center resources remain intact as we go forward. Finally, we're planning an individual support letter drive geared at different health center advocate constituencies. And what I mean by that is we'll be asking current and former health center board members, clinicians, staff, and partners to sign and submit individual Fix the Cliff letters of support to their members of Congress. I want to remind everybody that we are more than 150,000 people strong in terms of our health center staff and board members, and those are just the current members and board members and employees. If every single one of those board and staff members sign and send a letter, it will send a very critical message to Congress and to the President about the importance of fixing the cliff. On this initiative as well, we'll make sure to supply templates, talking points, and other resources to support advocates in this effort. So on this one as well, stay tuned for more information and details on the kickoff as the letter drive will launch in 2014. On both of these initiatives, again, we encourage feedback from everybody on the line. We value so much the suggestions and support from back home. You guys understand what's going to work on the ground better than anybody. So again, if you have thoughts on what we can be doing with our advocacy efforts and what resources you might need that I haven't mentioned, you can email us at grassroots@nac.com. Or again, on the call today, if you have questions, you can hit *3 to enter the queue. Again, it's *3 to ask questions live. So as always, just to wrap things up on the advocacy side, we will continue to have regular calls to action on health center policy issues throughout the year. We would encourage everybody to make a point to come to the Policy and Issues Forum this March. It's going to be a very, very critical year, and clearly we don't have a shortage of things going on. So make sure you're ready and prepared to be involved with our advocacy efforts in the next few weeks and in the year ahead. We are counting on everyone on the call today, and we're going to need thousands more advocates to step up and take action to ensure the success of the Health Centers program in 2014 and beyond. So I'm going to stop there. I know we've given everyone a lot of information today, and we've talked quite a bit. So we'd love to hear from you. Again, if you have questions, please press *3 now to enter the queue to ask your questions live. Before we turn over to Alex and see about some questions, Caitlin, do you want to speak to maybe the messaging around how folks can be communicating with their officials about some of the new access points?
Sure. I think Dan also has a question as well, but we'll yield to him in a second. But yes, one of the things that we always, hear as we're talking to legislators on the Hill is, health centers have received a lot of resources. And why do health centers continue to need additional resources when you've already received so much? I think there's a couple of things that we say in response to that. The first is when health centers are seeking funding for new access points, this is really funding for new communities that currently have absolutely no access to care or very limited access to care, in particular for those who are underserved, those who have insurance products that not all providers will accept, or those who have no insurance at all. And so health centers are often the only affordable provider in these underserved communities. And so we explain to them, health centers aren't asking for more to keep on doing the same thing. Health centers are actually seeking additional resources to do more, to care for more people. And certainly with new access points, that's the clearest case, because we explain that there's entire communities that don't have primary care providers. They have significant and documented proven shortage that's already been identified. At the same time, We also have been making a case to those on the Hill regarding existing health centers and the significant increases in demand, even within communities where we're already located. So, the demand for additional dental care, which, again, in many communities, nobody else besides the health center in the community may accept Medicaid for dental, or truly nobody may accept the uninsured. So we explain that health centers are seeking service expansions and expanded medical capacity grants so they can hire additional providers or expand the types of services that they offer. And then usually something clicks, and the staffer or the member of Congress or the senator gets it and understands. They know that there are dental, behavioral health, vision shortages within their communities. They know that it's hard for people who may have Medicaid, or people who may have no insurance at all, to find providers who will see them. And we explain that our additional resources will allow us to grow the capacity in order to care for these patients, and to do it in a way that is not only cost effective, that's high quality, and does it with dignity. And community involvement. So those messages have been working, and I think it's one of the reasons why we've had so much support the last several years for continuing to grow this program, even in the face of so many reductions to so many others. I think we may have a question at this point in time. Amanda?
Actually, before we take a question, I just want to do a quick poll here. We always really appreciate knowing who we have on the line today, so I'm going to do a quick poll. If you are a health center board member, please hit 1. If you are a health center staff member, please hit 2. If you are a health center patient, please hit 3. And if you are staff of a primary care association, could you please hit 4? And if you are any other kind of health center supporter that I have not mentioned, please hit 5. So again, health center board member, click 1. Health center staff, click 2. Health center patient, click 3. Primary care association staff, click 4. And any other type of supporter, please hit 5. Okay, with that, one last reminder on the questions. It's *3 if you'd like to enter the queue to ask your question live. But it does look like we have some folks on the line. Alex, do we have any questions?
Actually, Amanda, I have a question for Caitlin. And that question is, both you and I, Caitlin, have talked about the looming deadlines. There's the December 13, next Friday deadline for the Budget Committee to reach some kind of agreement, but we really haven't talked about or what. What happens if the Budget Committee doesn't reach agreement? And then we mentioned the second deadline, January 15th, when the current temporary funding resolution runs out. What has to happen by then in order for disaster to be avoided? So 2 deadlines, what do they mean?
Thank you, Dan. Yes, that's an excellent question, and we've been hearing that from a lot of folks in the field as well. There is a significant possibility that the Budget Conference Committee will not reach agreement by next week on a top-line number. I think we all have some degree of hope that they will. There's some buzz this week that they're moving towards that. But what if they don't? What's at stake? And that's the question that Dan was really honing in on. What's at stake is that right now the Budget Control Act, which was passed into law a couple years back, actually includes hard discretionary spending caps that basically are set in law. And absent an act of Congress, those are binding on the Appropriations Committee. Right now, the spending cap is $967 billion under the Budget Control Act. Now, that's just a number, but putting that in context, the Senate Appropriations Committee has moved forward with a number of spending bills, including the labor HHS bill that funds the health center program. To give you some perspective on the numbers, the Senate appropriations levels were $91 billion above the Budget Control Act. That's a huge divide. What that means is that a lot of these numbers we've seen, including the health center number, which was $3.8 billion in the Senate bill, and many other programs that health centers care about, were really contingent on that higher funding level that's way above the Budget Control Act. If this budget conference that's meeting doesn't reach agreement, either at by the December 13th date or shortly thereafter, the Budget Control Act numbers will be the operative numbers because those are set in law, which means that we will see programs funded at significantly lower levels than the Senate appropriations bills put forward. This can be done in one of two ways. Either the appropriations committees can themselves decide that they are going to write bills at these drastically lower funding levels, or they can simply do a continuing resolution at last year's funding levels and allow for massive across the board cuts to every program in government that's funded through discretionary funding. Now, we don't think that that is the way they would want to go. The appropriations committees would probably decide to write bills one at a time, but again, at a significantly lower level than what the Senate has already put forward, and frankly, what the House and some of its individual bills has put forward. The House has held back on moving a number of their appropriations bills that are the bills they've decided to absorb most of the pain from this lower spending level. And so both chambers have been struggling to really put together funding for fiscal year 14 that can work within this $967 billion limit, which is frankly our only hope for why they may actually reach agreement on a higher spending level next week. That would have to be replaced with some other form of reductions, possibly to mandatory spending programs. Now, some have said Medicare and Social Security would be off the table, but what else is in the mix is anybody's guess, and very little of that information in terms of what they're talking about to replace this sequester or this lower spending cap has been leaking out. So we're all continuing to wait and watch and see what comes out of that conference next week, if anything at all.
Thanks,
Kate. And I hear that we have another question. I'm going to actually read this one out here. We got a question on how do our advocates respond when someone asks, why do we need health centers post the Affordable Care Act? And I think with that one, I'm going to turn that over to Dan and get his take on what's the role of health centers post ACA.
See if I can give you three answers to that. First and most important, because somewhere in the range of 30 million people are going to gain insurance coverage at some point. First of all, once the website gets fully operational, through the state and federal exchanges, and secondly, through the Medicaid expansion, which, by the way, even though I know many of you are in states where your governor and your legislators have said, no way, we're not expanding Medicaid, we all remember the first years of Medicaid itself in the 1960s. It took about 5 years for most states to come in. And so we believe that over time, in fact, more states will join the Medicaid expansion group and expand coverage. But those 30 million people, by gaining a form of coverage, and this is particularly true for Medicaid, are not necessarily then going to gain automatically a place where they can use that coverage to get the care they need. That's where health centers come in. Number one, we're located in communities that are short of providers, by definition, medically underserved communities. And number two, the very people who come to health centers are folks who individually decide that that's where they want to get their health care, but oftentimes that's because they simply can't find another provider willing to accept whatever form of coverage they have, particularly true of Medicaid, and that's always the case. And so that's number one. Number two is that even after reform, there will be literally millions. The Congressional Budget Office projects over 30 million Americans will remain uninsured. That's almost 10% of the population. And those folks will have even fewer choices post-reform as to where they can go to get care. One of their other choices, and one that nobody wants to see folks exercise in greater numbers, is emergency rooms. It's the wrong place for the wrong care at the wrong time, whereas health centers are exactly the right place for folks to get the right kind of care at the right time. So those are a couple of very important reasons that health centers will be necessary and vital in a post-reform climate. A third reason, from my way of thinking, is that health centers represent a form of care that is focused on the individuals and on the communities where they serve. You are community health centers. You're focused on community health. I used a catchphrase from a guy named Wang Ji, who was the inventor of Chinese medicine back in 2450 BC, who says inferior doctors treat the disease. Sufficient or adequate doctors treat the patient. Superior doctors treat the community as a whole. And that's what health centers do. It's not just about individual personal health one by one. It is about that, but it's about so much more. It's about community health.
And now we have a question from Ivy from Urban Health Plan on the line. Ivy, would you like to ask your question live?
Oh, sure. I was just interested in finding out what the time frame was for all of the community engagement, the letters to our local elected officials, the individual letters, the new petition.
Great. Thanks, Ivy. This is Amanda. It's a good question, and I appreciate you bringing it up. I just want to remind folks that the petition, though it is something we started in the fall and we did have that October goal, the petition is something that we're doing ongoing. So for folks that had launched or were collecting, even beyond October or last month, please continue to do so and know that we will set a brand new goal after the first of the year. So the petition, you'll see new numbers, new goals, new directives, and again, we're going to open that petition up beyond just the administration to Congress as well, and that will start really after the very quickly after the first of the year. For the other two initiatives that I mentioned, the letters from local officials and the individual support letters from different advocate constituencies, those are also activities that I expect will start very early after the first of the year. We are still fleshing out details, and we want to make sure that we take into consideration all of the different resources that everybody in the field is going to need to make sure that those activities are going to be successful. But again, each of these activities will launch sometime in January, I would expect, no later than February, and will be probably ongoing well into the spring, perhaps even into the summer. We are going to need to make the case, obviously, on fixing the cliff, and so Congress, to some degree, will determine the timeline on how long we keep it open. But we will we'll get all of the information and the resources out to folks as quickly as we can after the first of the year. But just again, a reminder that petition is something that folks can be working on continually. And I would also say that we do have unfinished business, of course, for the next few weeks on FY14. So again, if you have an appropriator, you should expect to be taking action, be it phone calls to your members of Congress or sending emails, certainly inviting them to your health center to do a tour and so forth, and just be prepared. And for anybody who does not necessarily have a member of the Appropriations Committee, you can still be taking a lot of positive advocacy action. And what I mean by that is telling the health center story, educating the folks in your community, inviting your members of Congress to come and take a tour at the health center if they haven't been there recently. They're going to be home, quite honestly, around the holidays on recess for a good chunk of time. So it's a good opportunity to extend an invitation now to get them out to the health center. And if you're successful in confirming a meeting, don't forget to let us know. Those visits are something that we take into consideration when we're presenting congressional awards and trying to keep track of the level of support various members of Congress have demonstrated for different health centers. So look for lots of information on our latest advocacy efforts for 2014 coming out in early January, and be prepared for the next few weeks to respond as the calls to action come in. So I will pause there, and one more reminder, *3 if you have questions. Alex, do we have someone else in the queue?
We sure do, Amanda. We have next a question from Mike Wartsmith from Michigan. Mike, would you like to ask your question live?
Yes, thanks for taking the call. A question I had is I understood the green letter was specifically focused on the Democrats, and I understand the reason for that. It was to get the support of the president. My question is, going forward, is our advocacy efforts going to return to the bipartisan approach that we've had in the past, or are we going to continue to just focus on the Democrats in Congress and Senate?
Thanks, Mike. It's Caitlin answering your question here, and that is an excellent question. Absolutely, this effort will be bipartisan. It will have to be bipartisan in order to be successful. It's an unprecedented effort that we're going to be undertaking. There's no way that we can do it in the current environment, nor would we want to do it unless it was something that was embraced by Democrats and Republicans. We have to go to both, and we have to make a case that is, again, as you alluded to, embracing our history as a program that has been recognized as cost-effective by both Democrats and Republicans, and really as a key part of not only the safety net but the healthcare delivery system. You're right that we were focused on Democrats for the Green Cummings letter because it was geared towards the president. We've actually done something like this before in the past. Some of you may remember years ago when we had a Republican president, we would do some Republican-only sign-on letters geared towards President Bush. So we do have a little bit of a history of doing this from time to time. But absolutely, come the new year, and that's really a critical distinction. Once we have fiscal year 2014 appropriations wrapped up, signed into law, and we begin to turn our efforts to the campaign on fixing the cliff on the Hill, then we will absolutely be going bipartisan. NAC will be starting early on in the year, really working behind the scenes and with many of you who are key contacts with Republican members on a targeted basis to start to lay some of the groundwork prior to the P&I. But absolutely, in the lead up to the P&I, and by the time that we reach the P&I, we will be coming up here with a message that can be shared with Democrats and Republicans about the role of health centers in the healthcare system, what we deliver, the value that we offer, and that we are critical. And absolutely, we believe that our supporters, Democrat and Republican, nobody wants to see the ending of this program or to see health centers having to engage in, significant cutbacks, reductions of capacity, or closure of sites or anything of that sort. And nobody is saying that is going to happen, but certainly that's what's at stake with this health center funding cliff. And we don't think anybody who is a health center supporter on either side of the aisle wants to see that happen. So our job will be to educate them about what the stakes are, and then ask them to step up and stand up and help us to fix it so that nothing comes to fruition. So with that, I am going to turn it back over to Alex for our next question.
And next, I have a question from Michael from the 212 area code. Michael, I'm going to put you live. You have a question about our funding, and I'm going to let you ask it live on the air.
Hi, this is Michael from Callan Lord. I just had a question specifically. I know that the ask for fiscal year 15 is going to be $3.8 billion. Was just curious of what level we're currently funded at and what the difference in funding increases will be.
Thank you, Mike. Good to hear from you, and hope that things at Callum Lord are going well. Actually, $3.8 billion is the fiscal 14 funding level. We'll get to 15 in a second. And so, because of that, technically, our current funding is $3.8 billion, until or unless Congress cuts the funding. If they reach agreement on this budget committee action that creates a lower top-line number for all discretionary spending in the federal government, which, by the way, is about $1 trillion. If they cut that number, then it will have to be, as Caitlin said, either the appropriations committees will have to go back and create 12 appropriations bills, which is what funds all of government, to determine what funding levels, or they'll do some sort of across-the-board cut. If they were to cut the difference, the $90 billion, it would amount to about a 7% cut. Now, because last year we were at $3.1 billion, we technically have $700 million in new funding. HRSA has already, as Caitlin noted, pretty much obligated and spent about $150 million of that for the new access points they announced last month. But there's still $550 million, if you will, unspoken for. If they were to do a 7% across the board cut, which is about what the $90 billion reduction would amount to, that'd be about $200 million off of the health center funding. So instead of 550 unspoken for, we'd have 350 million unspoken for, but still available for new activities, new access points, expanded medical capacity, service expansions, etc. That's 2014, and we are fighting and hoping and pushing and shoving for the full 3.8 billion, so that all of that money can be put out on the streets and turned into more care for more people in more communities. The 2015 number is 5.2 billion. That's a 1.4 billion increase from 2014. It's the last year of the Affordable Care Act's Health Center Fund before we hit the cliff. And that 1.4 billion could fund care for more than 6 million patients, new patients now, across the country. That's what we're hoping and expecting is going to happen. So this is all by way of saying we fought for that money, we got it in the Affordable Care Act. It is one part of the Affordable Care Act that, despite all the partisan rancor around Obamacare, that no one has really taken a shot at, because everyone on both sides of the aisle understands the critical importance of care. And that's the appeal we're going to need to make on both sides of the aisle beginning in January to make sure that this funding cliff is fixed and resolved, and health centers don't face any threat of reduced funding going forward.
Thanks, Dan. And next we have a question from Victor Gomez from Southside Community Health Center in Minnesota. Victor, I'm going to put you live on the air.
Hello, everybody. President of Board of Directors of Southside Minnesota. Wondering if we could get a packet of information so that as a board I could share this information with the rest of my board members and kind of do a boot camp on during our next board meeting, so that we could be much more effective in our advocacy and outreach projects and be in lockstep with what it is that you guys are asking us to do, so that we can accomplish this more effectively.
Hey, Victor, this is Amanda, and I absolutely love that suggestion. I think it is well-timed and definitely something that we can work on absolutely to get it out for the first of the year as we really kind of take on the crux of the funding cliff efforts. And those are the kinds of suggestions, quite honestly, that we look for from the field. So I appreciate you stepping up to make the suggestion. Even in terms of, if you guys have a preference for video, for example, if you could use a 5-minute clip that's going to explain some of the stuff, or you're better with graphics, or if your folks want to be able to take home hard copies, that's the kind of information that we really rely on in order to make sure that the resources we put out there are going to be most effective. So if you don't mind, I will follow up with you after the call today, but I would, again, just encourage other folks on the line as well. *3 to ask a question, but also *3 to lend some suggestions, as Victor has. But again, I think it's well-timed and certainly something that we can work on. So thank you, Victor, and keep in touch if you think of other things that we can be doing to help out.
We greatly appreciate it. Thank you very much.
Alex, do we have another question?
We do. This one is from Franklin Gonzalez in Los Angeles County, California. Franklin, I'm going to put you live.
Hi, good afternoon. My question regards the renewal of the 330 funding. Once we get out of this cliff, what would be the time frame that we're looking for? Is it for 5 more additional years, 10 more additional years? Can you give me some details about that?
That's an excellent question. I'm so glad you asked. When we talk about fixing the health center funding cliff, what we mean as a starting point is between 2015 and 2016, the grant is facing a 70% reduction, the health center program funding, at least according to what's on the books right now. So as a preliminary step, we're proposing to fix that cliff and to make sure that in 2016 we don't have that drop-off on funding. But at the same time, we all have to acknowledge that 1 year is not going to provide enough certainty to all of you out there in the field regarding your future finances and resources. You don't plan in month increments. You don't even plan in 1 year increments. You need some assurance of funding beyond that. So what NAC has been proposing to the administration, and what we think of when we say a real fix to the cliff, is at least a 5-year renewal of funding. So 5 years of some assurance for health centers of what resources are going to be available to this program. So that's the pitch that we're making. And really part of the analysis, and as we get further down on the line in this and we do more education about the substance of what health centers can expect after healthcare reform, we'll be getting more into the weeds on this. But over the 5-year period that's to come after 2015, what will health centers need? What will your patient mix look like? What will the demand for services look like? What will your payer mix look like? All of that is going to feed into what kind of grant resources that you need for that 5-year period in order to sustain the patients that you have today and to grow to care for those patients in your communities who are going to be seeking care for the first time, both because of healthcare reform and because they're newly covered, but also because they are going to remain uninsured. And so what is the demand going to be? What are your resources going to be? And therefore, what are the grant requirements going to be? And that's really part of how we are focusing and talking about this request is 5 years of some kind of assurance of funding for community health centers. So excellent question, and that's the time frame that we're working
on. Billy Nash in Milwaukee, Wisconsin. Billy?
Hello, everyone. My question is, when we go to the P&I conferences every year, advocacy has a certain part it plays in it. And I'm just wondering, with the change in the environment of government nowadays, if advocacy maybe should play a larger part than what it does in the P&I conference. I thought it would be very good for the congressmen to see, instead of 10 people coming to speak to them, maybe there's a group of 30 or 40 people, the same number speaking, but just a larger group of people, and they say, these people are really serious. There's a lot of people, patients and board members that are really, want to see things happen that they're asking about. So I'm just wondering if that could be taken a look at.
Hey, Billy,
advocacy.
Yeah, this is Amanda. I think you make a really, really important point, and that is that this year and in this environment, it has never been more important for folks to come to the P&I. You are absolutely right. These members of Congress need to see with their eyes the number of people that show up to deliver the message, to insist that they fix the cliff immediately, to make sure that we're not dealing with that 70% reduction in 2016. So you are absolutely right that we need to show up in droves this year. The P&I really is all about advocacy. We offer as much programming as we can to make sure that folks have the training and the resources that they need to continue excellent operations back home. But truly what it's about is Hill Day. It's making sure that we're delivering the policy message and the advocacy message on the Hill. And so, the more people that we can get to attend the conference this year that make it a priority, that, set aside the budget dollars to make that happen, the better. And the stronger our message will be received. The only other thing I'm going to say, and I will give Caitlin an opportunity to chime in on this as well, and then I think we might have time for one more question. But the only other piece that I would mention is that it's also critically important when folks to go to those meetings that they make sure that they're prepared. And what I mean by that is making sure that everyone knows what the message and the ask is. You've talked through who's going to be delivering the message and who's going to tell the health center story, so that it's a very organized and very directed meeting and message and conversation. So those are all preparation items that we can do and we walk through when we're at the P&I. But again, Billy, I think you make an excellent point, and I just remind everybody that make your plans, mark your calendar now. The P&I is in March this year, as it is almost every year. It'll be important to get there to deliver that message to their members of Congress. Caitlin, do you have anything else you want to add?
Well, it's not Caitlin, it's Dan. Sorry. But I actually want to reinforce, Amanda, what you said. And provide a little historical context. I think most folks on the call know I've been doing this since God created Earth. They're going to drag me out with my boots on. But I remember in the late 70s and early 80s when we would come up to a policy and issues forum with in the range of 50 to 100 people here from all across the country. Now it's more like 2,500 people. But what has and that has a much greater impact than the 50 to 100 people did 30 years ago. I will say those 50 to 100 incredibly dedicated people made all the difference in the world in beating back the block grant, and the roughly 1,000 people who came in the late 1990s made all the difference in securing our Medicaid PPS payment and making sure we didn't lose our cost-based reimbursement. But what also has changed in this town is the sheer number of groups who come in and folks go up on the Hill and deliver their message. And so sometimes it's difficult to break through all that chatter. What does make a difference, Billy, and that's the point that you raised, is the sheer number of folks who might be part of a group visiting a member's office. I don't care how big a state they represent, California, New York, Florida. If 100 or 150 people show up for a meeting, that will make a huge and lasting impression. So numbers are vitally important. And Amanda, I also wanted to note that we are taking the advocacy our focus on advocacy up another couple of notches at this year's P&I Forum by having some very significant understanding Congress and conducting effective meetings with your member of Congress workshops on that first day of the P&I Forum. So not only should more people come, but they should come and be sure to be here on that first day, which is the Wednesday, because Thursday is Hill Day. That's when everybody goes up on the Hill. And so, by all means, I urge everyone on the call to think seriously about coming into town and being part of an effort, because this is going to take every ounce of advocacy strength that we've got in the health center movement to succeed. Amanda, back to you.
All right, I think we are getting close to time here, but there is one last very, very important question I think we want to have put out there. Alex, can you bring us up on the next question?
I sure can, Amanda. Thanks. Next we have, and last we have Dina Lon from San Francisco from the consortia out there. Dina?
Hi, I think you may have partially answered this in a previous question, but can you just give us a 10-second elevator pitch on what it means to fix the fiscal cliff?
Hey there, it's Caitlin. I will do my best to do the 10-second spiel. I, much like my boss Dan here, I'm not always known for my brevity, but I will say this. For starters, the 10-second pitch is first, fixing the health center cliff. We don't say fiscal cliff because that has another meaning here in Washington, but fixing the health center cliff means averting a 70% reduction to the health center program in fiscal year 2016 and providing health centers with the resources to continue their comprehensive model of care for all who need it in their communities, both those who they're serving today and those who are still there without care and need to be served. So I would put it at that. That's my 10-second effort. Maybe it was 25.
I'm pretty impressed, and I have to say, both Dan and Caitlin, you guys are a wealth of information. Brevity may not be a strong point, but that was impressive, Caitlin. We are going to stop there to be respectful of everybody's time. If you have a question and you didn't have an opportunity to answer or to ask live on the call today, you can stay on the line and leave us a message, and we will follow up with you individually to make sure that your questions are answered. So again, if you didn't have an opportunity live, you can stay on the line and we'll get to you after the call completes. I just want to say thank you again to everybody for being on the call today and for all of your wonderful advocacy work back home. We really depend on all of your hard work and support to make sure that we're successful. We couldn't do it without you, and don't worry, you'll be hearing from us often, very, very soon in the next few weeks and certainly in the year ahead. So thanks, everybody, and happy holidays. Bye-bye.
Yes. Happy holidays!